You can break for a free breakfast in Kearney tomorrow morning and in Grand Island Friday morning and learn more about cancer prevention. Nurse Practitioner Rachael Schmidt of the Fred and Pamela Buffa Cancer Center joins us now for more. Rachel, why does Nebraska Medicine feel these break for a free breakfast events just a great way to increase cancer awareness?
Break for Breakfast is a simple but powerful way to bring cancer awareness directly to the community. We like being able to meet people where they are, and in this case, it's in their cars. This way we can give health education and prevention a more approachable twist. Events like this allow us to connect with the individuals in a positive, non-clinical setting to give this trusted information and start the conversations about screening and early detection, which aligns with our mission to reduce the cancer burden across Nebraska through education and prevention.
When someone stops by the free Break for Breakfast cancer awareness events in Kearney tomorrow and in Grand Island on Friday, Rachel, how will that work?
It's very easy and convenient. You just pull up in your car. You do not need an appointment or any pre-registration. Our team will be flagging you down from the road, and you'll just follow the signs, and then we will hand you a free breakfast bag with educational materials right through your car window. You'll get the information about cancer screenings, and that includes when and how to get screened. And it's our way of making sure that while you're feeling your body, we're here to fuel awareness that could save your life.
Where and when does someone need to go for the Nebraska Medicine's Break for a Free Breakfast in Kearney tomorrow and Friday in Grand Island, Rachel?
In Kearney, the event takes place tomorrow from 6:30 a.m. to 8:30 a.m. at the Fred and Pamela Buffa Cancer Center in Kearney. And then in Grand Island, it will be on Friday, again from 6:30 to 8:30, but this is at the Nebraska Medicine Grand Island Health Center. They both will use the same format of the drive-through, grab a free breakfast, take home the important resources, and you can find the exact locations and times on the Nebraska Medicine webpage or Facebook.
Talking right now with Rachael Schmidt, nurse practitioner at the Fred and Pamela Buffa Cancer Center, learning more about the Nebraska Medicine's free Break for Breakfast cancer awareness events in Kearney and in Grand Island. Rachel, just how important are screenings in the fight against cancer, and also what are some ways we can learn when to schedule those screenings?
Yeah, so screenings are one of the most effective tools that we have in the fight against cancer. Many cancers like breast, colon, cervical, and lung can be caught very early, even before symptoms appear, and that's what we want to do. Early detection means that we have better outcomes and less invasive treatment, and we encourage everyone to talk to their primary care provider about the right screenings because there's different risk factors that may change when you should start, like age, family history, and other things.
And Rachel, what are the different ways we can lower our cancer risk, especially when it comes to physical activity and also being in the sun?
Knowing which factors we can control plays a huge role in lowering our risk for cancer. In fact, over 42% of cancers can actually be prevented through lifestyle changes, and these include eating healthier foods, being more physically active, maintaining a healthier weight, avoiding tobacco use, drinking less alcohol, and then also protecting your skin from the harmful UV exposures. Skin cancer is a big deal when it comes to the summer months. It's the most common cancer in the United States, but it also is the most preventable. Wearing that broad spectrum sunscreen, seeking shade during the hours of 10 to 4, and then also avoiding tanning beds are just simple ways that you can lower your risk.
We are what we eat and drink also applies to the risk of cancer. Rachel, what are some good things to remember for a healthy diet, also drink and body weight?
What we eat, drink, and how active we are can make a big difference when it comes to cancer risk. In fact, after not smoking, keeping a healthy weight is one of the best things that you can do to prevent cancer. We know that obesity is linked to at least 12 different types of cancer, including breast, colon, and pancreas, but only about half of Americans actually know about this connection. So a few simple things that we can do, or everyone can do to lower the risk is eat more fruits and vegetables and whole grains, move your body more regularly, cut back on alcohol and processed foods, and then aim for that healthier weight over time. It's not about perfection. It's more about creating sustainable habits, and these small changes really do add up, and they matter long term.
Rachel, is there anything else you would like to add about the Break for a Free Breakfast events coming up in Kearney tomorrow and in Grand Island on Friday?
Just that we hope we see you there.
That's Nurse Practitioner Rachael Schmidt of the Fred and Pamela Buffa Cancer Center talking about how we can lower our cancer risk. You can learn more at Nebraska Medicine's free Break for Breakfast Cancer Awareness events tomorrow and Friday morning from 6:30 to 8:30. The first one tomorrow morning is at the Fred and Pamela Buffa Cancer Center in Kearney, 2232 Chancellors Avenue. The Friday morning event at Nebraska Medicine's Grand Island Health Center, 729 North Custer Avenue. I'm Paul Perkins on the Rural Radio Network.